Well, both MRI systems, conventional tunnel systems and the open system, work on the principle of using a magnetic field and pulses of radio waves. But the primary difference is that a conventional tunnel scanner is, as its name suggests, a tube. And the patient lies in the centre of the tube and the tube is very close to them, so they have something directly in front of them. Open systems don't. The patient actually is positioned between two vertical magnets and there is nothing in front of the patient. And that has a massive benefit in terms of claustrophobia and makes the examination much more comfortable. MRI is a safe investigation. It doesn't use ionising radiation, so it's quite different to conventional X-ray techniques or even CT scanning techniques. A primary advantage of the open MRI is that it's possible to image the patient either lying flat or standing or sitting. They have the ability to image the patient either with movement, so we can do both flexion and extension movements, or we can actually take the pictures in positions that the patients experience their symptoms. The DVD system in the open upright MRI scanner has significant advantages compared with conventional tunnel systems, which basically are restricted to the patient being able to listen to music. Here they can actually watch TV or they can watch a DVD, and because they're more engrossed in what they're watching, they're less likely to move. Claustrophobia is actually a very common condition. It used to be said that claustrophobia affects approximately 10% of the population, where in reality it's much closer to 30%. But the 10% applies to those patients that couldn't undergo a conventional tunnel system without some sort of help. And that usually involves oral sedation, but can involve a general anaesthetic, and that clearly has risks. Using an open scanner, there are some significant safety benefits to the patient. Bariatric and significantly overweight patients have problems accessing MRI scans. They can't fit into the tunnel systems and they often exceed the table weight limit. Because the open upright MRI has vertical magnets, they can actually access the scanner and the table weight limits don't apply. The routine turnaround time on images is around 48 hours or less. Urgent findings, of course, are communicated much faster than that. We have radiologists who are of national reputation and specialists in their field. So it isn't that the examinations are reported by general radiologists, they are actually reported by experts with a huge amount of experience in that area. All imaging systems have compromises. There's always a compromise between resolution, background noise, all sorts of different things come into play, and we optimize the sequences and we optimize the characteristics of the scanner to provide the most accurate diagnostic information that we can. On the open upright MRI, we have really nice diagnostic images, particularly useful in the spine and the central nervous system and in large joints. And that's where it really comes into its own.